Hi everyone, welcome back to my channel, The Vision Tutorials. Today's topic is First Aid Awareness. First aid helps ensure that the right methods of administering medical assistance are provided. Knowing how to help a person is just as important in emergency situation. We may come across of accidents at a workplace, such as a person losing consciousness due to a fall or an electric shock. Let's begin today's training with a slogan. Accidents do happen. Make first aid as your best mate. Safety brings first aid to the uninjured. Give a life a second chance. First aid first. Let's begin today's training. Let's understand the importance of first aid. Not every job is dangerous, but every employer is responsible for the safety of their employees in the workplace. One of the best ways for the employers to meet their legal and moral obligations to their employees is to provide first aid training to the employees. Let's understand the benefits for employers. The first is faster response during an emergency. In the event of an emergency, a fast employee response can save lives. A quick response can reduce recovery time, leading to less time lost from injuries. Second, reduce workplace accidents through awareness. First aid training helps employees learn to be more conscious of safety in the workplace, leading to reduced number of accidents and injuries. Third, a more positive work environment. By making first aid training available to employees, employers can show their workplace that they care about providing safety work environment. Let's understand the benefits for employees. First is safety in the workplace. Employees benefit from others around them receiving first aid training because it keeps them safer. Safety at home. Training in first aid is just as useful outside of the workplace. Knowing first aid could someday help to save the life of a friend or a family member. Safety while working alone. First aid training can teach employees how to properly use first aid kits and to stay calm during an emergency. The first aid technique is Cardiopulmonary resuscitation, a CPR technique. A CPR is an emergency procedure that combines chest compressions, often with artificial ventilation. It is done in an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in a person who is in a cardiac arrest. The first step is to assess whether a person is awake. If there is no response, call for help. If no one is available to help, be calm and act. Bring the person to the safer side. Third, clear the airways with your index finger if there is saliva or foreign particle blocking the airways. Check breathing by bringing the ears close to the person's mouth. Listen for breath and feel the breath. Give 2 breaths by pinching the nose. Check the chest expansion. Check the pulse by 2 fingers on the side for 2 to 5 minutes. If you don't feel the pulse, start the compression. Let's watch a video to understand better the CPR technique.
Hello, in this health sketch, we want to talk to you about CPR, which stands for Cardiopulmonary Resuscitation. We use CPR when someone has collapsed and is not breathing, because it can keep people alive until emergency services arrive. Learning these simple life-saving skills is as easy as ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulders and ask them loudly, "Are you all right?" If there is no response, you need to. S, shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. And try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when the heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the center of the person's chest and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second. And hard means that the chest needs to go down by about 5 centimeters. This might sound a lot, but you do need to push hard for it to be effective. If you have been trained, you can give 2 rescue breaths after every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, just keep going with hands-only continuous chest compressions. If someone else is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person is definitely breathing normally. Sometimes we can add another step. D. D is for defibrillation, which is about delivering a shock to restart the heartbeat. Some public areas and workplaces have an easy-to-use defibrillator on site called an automatic external defibrillator, or AED. Automatic means that it is the machine that decides what to do, so you can't go wrong, and it even talks you through the steps. If there is no AED available, keep going with CPR until the ambulance arrives. That's it. So to recap, remember doctor's ABC, and if you have it, D. That's D for danger, R for response, S, shout for help, A for airway, B for breathing, C for circulation, and D for defibrillation.
In the next video, I will be discussing about how to treat the burn blisters and how to treat an electric shock victim. Safety is everyone's responsibility. Be safe, be healthy, enjoy your workspace. Thank you.